Well, first off, I just want to thank everyone for coming. It's great to see everyone. We haven't done this for a couple years now, but it's really great that you all can make it out here. We're kind of doing a little smaller venue, a little more one-on-one, and it was really quite awesome that when we did the ticket thing to get a spot, we kind of sold out in our limited number in about 2.5 hours. So it went really fast. And there was a nice little waiting list. We're going to do another one with some different topics in February. It's going to be up in the Balzac Casino at the racetrack. So keep your eyes out for that. That'll be in February, and we'll send out some info on that soon. I think I know a lot of you I don't know, but I'm Chris Berezowski. I'm one of the vets, one of the owners in the practice, and I guess I'm going to be the MC today. I think we have a really good lineup, a lot of variety of topics, a lot of it mainly focused on kind of the performance horse and sport horse type aspect. And so we're going to have three presentations this morning. Then we're going to break around 12 for lunch. They put together a really nice lunch of some salads, sandwiches. There's coffee, pop, cookies back over there. So just go help yourself whenever you want. In between presentations, whatever you want. Just go get a snack. There's some water up there. We have pens and Post-it notes. Just kind of grab some of those if you'd like. After we do lunch, so probably about 12:30 or so, we're going to do some door prize draws. So we have a really great bunch of stuff that's been donated from some of the drug companies and our suppliers, things like that. And the way it's going to work is kind of the first ticket drawn goes up, and you kind of get your pick of what's up there, and then the second ticket, and so on. So it's all really good stuff, but the early people are going to get their pick of the litter. We also have, at 1 o'clock, we're going to have a representative from Platinum Performance. She's going to zoom in and give us a Zoom presentation on some nutritional ideas. And then after her presentation, they donated 2 big buckets of Platinum Performance. So then we're going to do the draw for those 2 buckets. So 2 lucky people will get that prize, which is a pretty good prize. Otherwise, just make yourself comfortable. Definitely, we have a good group of our team here. We're all wearing these little badges. So if you have questions or you just want to chat with us or just anything, just come say hi. We're here to help you out, help you have a good time. And I think that's all the housekeeping things. The restrooms are around the corner. Coffee, pop, water. Just really make yourselves comfortable and get whatever you need. I think now we'll get rolling on our first topic. And then at the end of their topic, we'll have some questions and time for that in between. So, but even if you have a question during, just fire up your hand and we'll be happy to answer that. So to start things off, I have these 3 nice young ladies. These are 3 of our interns. So we have 6 interns in our practice right now. And so an intern veterinarian, they're real veterinarians. They have graduated from vet school. They know what they're doing. But it's usually their first year out of school. So it's their first year out of school. They come and work with us for a year. It's a really intense year. These ladies are often, working nonstop, a little sleep deprived, a little tired. But they do an excellent job, and they learn so much. And so what they're going to do today is they're going to take us through kind of the basics of a lameness exam. So when you bring your horse in, or we come out to your place and look at your horse because it's not performing well or it's lame or something, they're going to kind of walk us through what we're doing, what we're looking for, and kind of some of those basics. Then after them, we're going to get into some of the other presentations around some of the treatment aspects with the lame horse. All right, ladies, take it away.
All right, so good morning, everyone. Just like Dr. Berezowski said, we're going to be going through the lameness exam. I know that many of you guys have probably been through the process of the lameness exam, trying to figure out kind of what's going on with your horses. So we thought that it'd be a really good idea to kind of, go through why a thorough lameness exam that we do is so important when trying to identify and treat those lameness issues. All right, so first off, I just wanted to introduce us. Just like Dr. Berezowski, we are the intern veterinarians. I'm Dr. Annie King. We have Dr. Carrie Dyson as well as Dr. Hannah Morrison. You guys have probably seen our faces around the clinic, and if you haven't, then you will definitely see them for the rest of the year.
All right, so our presentation today will just be sort of an overview of what you can expect when you bring in one of your horses for a lameness or performance evaluation. We'll sort of start with why clients usually present for a lameness evaluation at the clinic and what you can expect to be part of that exam, followed by some basics and confirmation that may affect soundness in your equine athlete, and then we'll go over the basics of a thorough musculoskeletal palpation, as well as some further diagnostics that might be required to get to the root of your concerns.
Alrighty, so why do we perform the lameness exam? There's multiple reasons, but really ultimately when we see kind of an unsoundness in a horse, it's a sign that there's something kind of underlying, and so we kind of want to get to the bottom of that and try and diagnose the root of the problem and see what we can do to kind of help them along the way. So that may be soreness, something that you kind of know exactly where it's coming from or have an idea. Or even poor performance, so it might not be an overt lameness necessarily, but you know your horse and you know it's just not performing quite right, so you kind of want to see if it's something musculoskeletal or related that we could potentially fix or deal with. And then a lot of kind of our equine athletes really come for regular checkups because you maybe know already kind of where your horse struggles and what we do to sort of deal with that, and you bring them in kind of regularly to keep on top of it and monitor any progression or change with that. And then of course another big reason is on pre-purchase examinations, so just checking that the horse is going to be sound for its intended job.
Alright, so a thorough lameness exam can be pretty time and energy intensive, as I'm sure a lot of you guys know, and it involves multiple steps. These include taking a very thorough history, as well as an exam from a bit of a distance to see what the horse is doing, so we can kind of understand what you guys are seeing yourself. We also go through pretty thorough palpation manipulation of that musculoskeletal system, as well as watching the horse go and assessing their gait. We also, should the situation require it, we go through any further diagnostics as needed. So now we'll be going through each of these steps in further detail, starting with taking a history.
So we do tend to ask you guys lots of questions when you come in. Even small details can give us some clues as to what may be going on and why they aren't at pre-performance. So questions such as when did the problem start can give us clues as to whether this is sort of a chronic problem that's worsening, such as sort of arthritis, or if this is an acute injury like heaven forbid, a fracture or foot abscess. We also like to know changes in management or workload, just because that gives us a good idea if it's aggravating a previous injury. Or if your horse is extremely lame after a month off, that's also something we like to know. And then we know that you may have tried some things before you come to us, which is totally fine, but we'd like to know how they reacted to those treatments. So if they had 5 days of bute, did that help? Have you previously had joint injections? Do they work out of the lameness, or do they get worse with exercise? All of these can sort of help us narrow down our list of possible causes for the lameness.
And so, as Annie mentioned, the first thing we'll do is our distance examination. So just watching, a big thing is always their feet, and that can vary between breeds, of course, but just watching kind of how they stand. Of course, it's quite common a horse will rest a back leg, but if we notice they're resting a front leg, that's obviously a big thing to note. And sometimes, if they're standing with one leg out to the side, it's like, why are they doing that? It might just be that they've kind of park themselves that way and need to give them a little push, and then they're like, okay, I'm standing normal again. But just kind of noticing those things, and then again with breeds, you can notice sort of different conformational things that are normal for that breed, but would kind of alarm you maybe if you saw them in a different horse. And then with more kind of chronic situations, you'll see things like muscle asymmetry. If you've had a lameness in a certain limb that's been more of a chronic lesion, and they're maybe compensating over time. So we'll kind of try and assess all of those things from a distance before getting our hands on. And so this picture is sort of just illustrating some different conformational things that we may take note of. So the top images are showing sort of different angles through the fetlock joint, and then on the bottom is just showing more sort of different angles through the hoof. And again, it's very rare that a horse is perfectly straight in all of its areas and perfectly symmetrical. So these are things we notice and work with, but it doesn't mean, this horse is not going to be sound for the rest of its life. It's just, again, something we note and work with going forward. And this is just showing sort of similar idea, but sort of higher up the leg. And again, something we take note of, and we look maybe closer in that particular area where we're seeing the abnormality, and just work with that going forward.
All right, so moving on in our lameness exam, a really important part is going through the musculoskeletal and being super hands-on. During this part of the exam, we poke and prod just about every inch of the horse, and this is really important for helping us to find any swellings, any kind of areas of pain, or any heat. Any findings that we do find should be repeatable, so you'll often see that if we kind of get a bit of a reaction from your horse, we try it again and again. If they only flinch once, that doesn't necessarily tell us anything. It could just be a horse being a horse. But if we get it repeatable, then that's usually a pretty good indication that there is something there that's causing them a bit of discomfort. As well with this, we go through some manipulation. So that's probably, you guys have noticed as we pick up the legs and we kind of twist the foot around a little bit, bend at the fetlock, bend at the knee. So this is us manually assessing the range of motion in all of the joints. So what we're looking for is if it might be reduced, such as in cases of scar formation or potentially arthritis. And then it may be increased if there's supporting structures, so those soft tissues like ligaments. If there's any damage, that might cause an increased range of motion. So we're not just playing with your horse's foot, we are actually, taking a bit of an idea of what's going on. And so here we just have a bit of a video of going through the musculoskeletal exam, that palpation. Dr. Pally here, as you can see, is going pretty quick because we're able to kind of figure out what's going on. It's a bit of pattern recognition for sure. So she's feeling all throughout the neck, kind of those cervical vertebrae. She's pushing fairly hard, as they do have quite a lot of tissue. So we're really looking for any sort of reaction or response from the horse that, again, is repeatable. In this video, we're going all the way down the leg, so you're looking for any effusion, so any extra fluid in the joints that could tell us that, okay, maybe there's a problem in that specific area. Again, she's bending the leg, feeling those tendons. It's really important for us to lift each leg, as when they lift up the leg, the soft tissues feel totally different, and so we can get a bit of a different idea as to what's going on. And so really thorough, and this video is only looking at kind of that front quarter, but we go through the entire horse, going through the back and everything, and that just, before we even see them go a lot of the time, it gives us a really good idea of, if they're going to be a little bit ouchy, if we're touching one of the ligaments on their, say their front right, that gives us a good idea of something to look forward to. You can see that she's kind of going through the carpus, so that knee joint, and looking for any of that effusion, so extra fluid. And so it's pretty quick, but it can tell us a lot of information, and then we're going to go on to the next step.
So one of the most important parts of our evaluation is our gait analysis. So this is sort of tells us, we're looking straight at the horse. Is anything uneven? Is anything showing us a head nod? So we learn in school kind of a little mnemonic to help us remember. So the horse's head should go down on the sound leg and up on the sore leg. So we're watching for any asymmetry in stride, any asymmetry in foot placement. Are they moving strangely? So are they sort of swinging their leg around because the joints are hurting? Are the hips moving with asymmetry? So are they kind of limping on one leg so it's moving much higher than the other? And that kind of gives us an idea of what leg may be sore. And from then we can kind of figure out where in that leg might be sore.
So then following on from this, we use some kind of diagnostic tools to help us further narrow things down. So we'll usually move on to flexion tests, and so that the idea of that is to kind of put a certain area under kind of an increased amount of tension, and then If they have an increase in lameness after you're putting that specific area under a little more pressure, that tells us that potentially that's an area to look at. So if we say a horse is positive to that flexion, then that means we've basically made them more lame by putting that area under a little more tension. So it's a really useful test, but it's not very specific because it can mean, quite a lot of structures in that area that could be affected. So that's when we use our nerve blocks really to kind of narrow things down and we have a better idea of the areas we are desensitizing, and that's what we're doing with the nerve blocks, is really making that area essentially numb. So they should, in theory, if they are positive then to that and they have a good response to that, then that tells us that the lameness is likely in that area that we blocked. And then imaging, we can use then to get a better idea of what's going on inside the horse.
All right, so we have this video here of Dr. Carrie Dyson doing one of those flexion tests. So she's doing the hind limb lower. So she's bending at that fetlock joint, and then we watch the horse go. This horse was sound, which is great. We like it when they're like that. And so that is something that gives us a really good idea of where that lameness may be to help us narrow down what further diagnostics we need to do.
And then once we have done those flexions, we've found an area that's hurting, we sort of want to localize even further. So we may do some regional anesthesia, essentially. So we put something then in the leg that numbs it. And we usually start at the bottom and work our way up so that we can figure out where in the limb it is. So we've got our Palmer digital digital nerve block, which essentially just desensitizes the back of the foot. And if that doesn't make your horse feel any better, then we sort of move up the leg there to the abaxial, the low forepoint, and the high forepoint. So that region in blue is essentially if the injury is in that area and that is what's sore, we'll do the regional block, we'll see if that gets better. And then that sort of tells us that from there down is where the injury is. And then if those don't work, we can also block certain joints if we're suspicious of a certain joint that's also hurting.
And then this is just a slide to show kind of some more common imaging modalities we use. So we use radiographs really to have a look at the bone in the limb, and then ultrasound is really great for soft tissue structures. And then we can move to sort of more advanced imaging modalities such as MRI or bone scan. And MRI is really great for foot lameness.
All right, and it's also really important that we remember that, for one thing, horses never read the textbook, and another thing is that poor performance may not always be due to a lameness. So we always keep our mind open during a lameness exam, then we consider non-musculoskeletal causes of that poor performance. So systemic disease, such as lung disease, can actually be quite painful for horses, and so may make them appear as though they are uncomfortable and lame. So we always keep that in our mind whenever we're looking at a horse, especially when they're being presented with the complaint of just poor performance. I'm sure everyone has at some point gone through the stress and nightmare of trying to find the perfectly fitting saddle. So of course, tack fitting can definitely cause horses to be sore, especially through their back. So that's something that we always take into consideration, especially in horses that are changing a lot. A saddle that might have fit at one point, if their back has changed, might not be the greatest fit now. As well, behavioral issues can definitely be a cause of poor performance, or perhaps a cause of you starting to think that the horse is in pain. So we always consider those as well.
All right, so I'm sure you thought that we wouldn't ask you any questions, but we thought we'd let you give it a go with a sort of basic lameness to see if you've been listening. All right. So we did steal a video from Guelph for you guys to look at. So we're looking for that down on sound, up on sore. So just have a look and see what you think you see. This guy is fairly sore, and they trot him a lot, so. Up on consort, down on sound. All right, so I'll give you a clue, it's the front. So if you think it's the left limb, who thinks it's the left limb? And you think it's the left limb? Perfect. And you think it's the right limb? You guys are all experts already. You didn't need us at all. And that is all we have for today, just a basic overview. Do we have any questions?
How do you assess bilateral lameness?
Pardon?
How do you assess bilateral lameness?
Sure. Yeah, so that's a really good question because that can definitely kind of foil our plans a lot of the time because it can be tricky. It can also be tricky because the horse may not appear as lame to you guys. And so something that we often look for is, especially if it's a bit of an uneven bilateral, is that if, say, okay, we're like, okay, we think it's the right, maybe it's the right front, and then we say we're going through those diagnostics like we chatted with, and we did that block on the right, and then all of a sudden, really sore on the left. And it's like, ooh, okay, that's suspicious. So that would definitely be a way is that, you know, when we do that block, we aren't necessarily looking for just an improvement, we're looking for a change in that lameness. So that was a really good question. It definitely can be tricky to have those bilateral lamenesses because they may not be quite so upfront, especially looking at that gait analysis. But as well, on the palpation, we may get that response where they're a bit ouchy on both legs or the number of legs that they are sore on. Yeah.
Just to add on to that, we will also, like you, I'm sure all of you have seen, put them on the circle as well, which especially with forelimb lameness can be really helpful because you're putting a little more pressure on that inside leg. So that's a case where maybe you see both directions. The inside leg is more lame or whichever, if it's like a push-off lameness behind, maybe going a certain direction, you see one leg more than the other.
And that's too where our flexions can be quite helpful. So if they are bilaterally lame, kind of mildly on both legs, if you flex it, that one leg will still be, you know, worse than the other side. So then we flex it, it's suddenly ouchy on the left, and you flex it, and it's ouchy on the right after you flex it.
I wonder if Moore Company is seeing a role for the new computerized systems where you put the monitor directly on the back of the butt and then on the front leg to get some data around their limb asymmetry.
I think we have one at the South Clinic, don't we? I know our surgeons don't use them as often because they're super special, very well trained eyes, but we do have that technology down at the South that we can use.
And when do you use it?
It's sort of used in conjunction with all of our other diagnostics, so it's just another piece of the puzzle that can give us more information, honestly.
I think a lot of the time too, it's kind of clinician preference, whether they like to use it or not. Yeah, I think it could definitely be an interesting piece to kind of add to your lameness puzzle as more of an objective analysis. But I think, again, most clinicians would say that you always kind of take it into consideration with your own clinical judgment for sure.
I'm curious to know, do you ladies perform surgeries at all? Because you were saying surgeon.
We don't primarily perform surgery, but we usually assist the surgeons in surgery, so we're very good at handing instruments to the surgeons.
Holding things.
And holding things.
What do you think is the best way to tell whether the lameness is in the front or the back?
I think the front lameness is like that classic head hike, so they're really bouncing their head. Whereas when we're looking at a rear lameness, we're usually looking at the symmetry of the hips and the movement. So if there's more movement on one side, that's usually indicative of hindlimb lameness.
All right, well, if there aren't any more questions, thank you, ladies. Okay, and they have to run off and go back to work now. While we get set up for the next one, if you want to take a couple minutes and get a cookie or get a coffee, feel free, and we'll just get organized on the next one. Make our way back to our seats. We'll get get rolling with the next one. So next up we have Dr. Jenna Lambert. She was, just like the young ladies that are up here, she was one of our interns a few years ago. And she went away and she went to Tufts University to do a surgery residency. And we thought she was gone, we thought we were done with her and never see her again. But she has come back and now she's one of our newest surgeon. And she's taking some time right now to study for her board exam, which is in a couple months, and it's quite a big ordeal. So it does take a lot of time to prepare for that. So you won't see her around the clinic right now, but early in 2023, I'm sure you'll see her around. And she's going to give us a nice talk today on some of the therapies for joint issues, arthritis, lameness. We have a nice little introduction. Now we're going to talk a little bit about some of the treatments that are out there. Take it away, Jenna.
Thank you very much. All right, so today, just like Dr. Berezowski said, we're going to look at joint disease, sort of generally speaking, in the horse, and then focus on some therapies, specifically biologic therapies that we have to sort of target treating some of these diseases. So what we're going to look at today first is we're going to start with the anatomy of the joint, because I think first to understand all the different components of a joint is important to then understanding why we're using these therapies to target these different specific diseases. So in terms of our biologic therapies, we're going to be looking at IRAP, PRP, Prostride, alpha-2EQ, and stem cells. And specifically these ones because they're most commonly used, I would say, up until this time point, and also because these are the ones that we have available to us at our hospital. So like I said, the key to understanding joint disease is to really first understand the basic anatomy of a joint. And once we understand all of these different components, we can understand how each component can become individually or injured at the same time, and thereby how we can direct our different treatments. So this is a very basic picture of a joint and all the different components. So the first component is the articular cartilage, which is this layer here. If I can keep my pointer steady. So this articular cartilage basically covers each end of the bone and allows the bone ends to glide against each other with very little friction. The next layer is the subchondral bone layer, which is basically directly beneath this articular cartilage layer, sub meaning under, and chondral meaning cartilage, so basically it's directly under the cartilage. And this layer supports the cartilage in addition to reducing the forces that are generated by everyday activity and athleticism. The subchondral bone also has a very rich blood supply and an extensive nerve supply as well. So it's very important for the perception of pain, which occurs with a lot of our joint diseases. Next, we have the synovial membrane, which is responsible for the production of synovial fluid, as well as for the removal of waste products from the joint. The synovial fluid is actually very similar to plasma within the blood. However, it also has a hyaluronic acid component, which makes the joint fluid thicker and really helps reduce wear and tear and reduce friction within the joint as well. And then, of course, we need something to keep all of this stuff together within the joint. So that's going to be the joint capsule on the outside, and many times ligaments, which can either be inside the joint or outside the joint. We can also have other soft tissue structures within the joint itself, such as the meniscus or the cruciate ligaments that are found within the knee or the stifle. And a lot of those soft tissue structures really help transfer load between the bone ends, especially when the bone ends aren't the exact same shape. So I would say at least a couple times a week I get asked, why does my 6-year-old, 5-year-old, 4-year-old horse already have signs of joint disease when he hasn't done anything? And I think this can occur for a number of reasons, but oftentimes I suspect there are multiple factors at play. So the first main category, sort of keeping it general, is having an abnormal stress placed on normal cartilage. And so abnormal stresses could be caused by loss of joint stability. So this once harmonious balance between all these different structures that we mentioned before becomes disrupted. And so this could occur with a severe injury like a fracture, so especially fractures that go through that joint surface. That once really smooth articular cartilage that you have is now disrupted. It can also occur with severe soft tissue injuries. And so these ligaments and soft tissue structures that were responsible for keeping that joint in alignment, transferring load, allowing horses to do these super athletic maneuvers that we expected them have been disrupted, and that creates instability within the joint as well. And I suspect a lot of times in more subtle soft tissue injuries, these micro movements and changes within the dynamics of the joint also can predispose to changes, inflammation, and subsequently joint disease going down the road. Some of those soft tissue structures within the joint can also become injured. So specifically talking about, for example, the meniscus or cruciate ligament injuries. If we look at injuries in dogs, for example, I'm sure many of you have had a dog that has a cruciate ligament tear. Even despite whatever treatment you choose, whether if it's surgery or medical management, we know that all of those cases, all those dogs, are going to be predisposed to osteoarthritis in that joint going down the road. So the next category is having normal stresses placed on abnormal cartilage. And cartilage can be abnormal in a young horse due to something like a developmental disease. Osteochondrosis is a common one, OCD, I'm sure many of you have heard of that. And this disease will often lead to flaps of cartilage or even little bone fragments that are not attached anymore. And if they're not removed or even possibly not even recognized that they're there, they can create ongoing inflammation within the joint and then result in degenerative joint disease again down the road. Another cause is joint infection, and this is why we take joint infections so seriously in the horse. So an infection within the joint leads to a massive inflammatory response within the joint, the breakdown of articular cartilage, and the loss of that hyaluronic acid component within the synovial fluid. And if we remember from earlier, that hyaluronic acid component makes that joint fluid thick and reduces friction between the bone ends. And these changes, interestingly, are actually similar to what happens in rheumatoid arthritis in people. And then the final category, and maybe the one that we think of most commonly, is athletic or cyclic trauma. So this is classically known as your wear and tear injuries, which lead to repetitive impact trauma and changes in the joint components that we already discussed previously. So wear and tear injuries are extremely common in human athletes, and this is from performing the same movements over and over again. So think of like a tennis elbow in a tennis player. And this goes for the equine athletes as well, because a lot of our performance horses are basically performing the same movements over and over again. So this is just a diagram comparing an abnormal joint to a joint with osteoarthritis. So the normal is on the left side, and the abnormal is on the right side. So the first thing that we see is thickening of the joint capsule, which is called capsular fibrosis. So that's what's happening right here. Synovitis, or inflammation and thickening of this synovial lining. So if we remember, that synovial lining is responsible for producing the synovial fluid that we rely on to reduce friction again, and also to remove waste product from the joint. We have cartilage failure. So if you see on the right side, there's irregularity and fibrillation within this cartilage as compared to the left side. And you can actually get full cartilage erosion and then exposure of this subchondral bone in really severe cases. We have breakdown of the hyaluronic acid molecule within the synovial fluid. So if you've ever had your horse's joint injected, maybe they have osteoarthritis and you know that you're treating them for ongoing joint inflammation. If you ever had the vet put the needle in and the fluid comes out and they say, oh, it's really watery, that's because they have a breakdown of hyaluronic acid in their joint fluid. We can have osteophytes, which are basically bone spurs that come off that articular surface, disease of that subchondral bone, and then disruption of the vascular supply. So these vessels, which should be nice, evenly spaced here, become sort of engorged, and they're just not able to function normally anymore. So, after we've talked about this, now we're going to talk about how we can potentially help these horses. And so today we're going to be focusing on biologic therapies. And there are multiple biologic therapies available. We're going to talk about a bunch of them today, but there's other ones that I'm not even mentioning that are still sort of coming up in the research and in the pipelines. So orthobiologics, or biologics, are defined by the National Institute of Health as treatments that use substances made from living tissue, living organisms. And for our purposes, these are primarily created from either the horse's blood or the bone marrow. These products are under the jurisdiction of the FDA in the US and the CFIA in Canada, and these therapies don't actually come with labels for approved conditions or dosages or routes of administration like a lot of the other drugs that we already use. And so this, in part, is probably why you'll see a lot of different veterinarians actually use them in different ways. They might use them at different dosages or at different frequencies. And that's mostly just based upon their experience level and what the research is telling us so far. So let's dive in. This might get a little sciencey, so just hang in there with me. So the first one is IRAP. The generic name is called autologous conditioned serum, and IRAP is the trade name, and IRAP basically stands for interleukin receptor antagonist protein. So this is created by collecting the patient's blood, and it's incubated with medical grade glass beads. And a certain type of white blood cell called monocytes bind to these glass beads, and over the next 24 hours, stimulates the production of regenerative and anti-inflammatory proteins. So interleukin-1 is a well-known pro-inflammatory protein, so it creates inflammation in the joint. And we know that it's present in very high amounts in joints that are very inflamed, especially joints that are osteoarthritic. So the IRAP system produces a concentrated amount of this receptor antagonist protein, which is basically like the bodyguard against IL-1. So this receptor antagonist is produced in high amounts, and it's trying to come in and block these destructive effects of the IL-1 protein. It's more likely that this IRAP product actually has a combination of other anti-inflammatory proteins as well. We know that IL-1 antagonist is the one that we're sort of targeting, but it's probably more of like an anti-inflammatory soup that we're creating that's then contributing to the beneficial effects. So clinically, the use of the product is aimed at utilizing this anti-inflammatory effect. So we often will recommend it following arthroscopic surgery of a joint, where we know there's been articular cartilage damage already, cases of mild to moderate arthritis, cases of confirmed joint inflammation, so they might not necessarily even have a cartilage lesion, but maybe we know that there's increased inflammation from our palpation, from our ultrasound. Maybe we see more joint fluid on the ultrasound. Maybe we see that the synovium is inflamed on the ultrasound. Or even more advanced imaging like our bone scans that really pick up inflammation and active remodeling in certain joints. I would say cases that are less ideal candidates for IRAP are cases of really advanced joint disease, where you know that the articular cartilage is eroded, the subchondral bone is exposed. The IRAP product isn't going to reform cartilage from nothing, so in those severe cases, you might need to look at different therapies or different treatment options. Okay, so moving on to platelet-rich plasma. Many of you have probably used or heard of this product as well. And the use of this product actually started around 1998 with reports in healing mandibular bone defects in humans, actually. And as the name indicates, platelet-rich plasma, sorry, I've messed up my thing here, basically creates a concentration of platelets that would be in a significantly higher volume than what you're going to find in the blood when you first pull the product. And it's thought that the delivery of PRP mimics and enhances the normal process of clotting and wound repair, which stimulates regeneration of normal tissues. So you're going to hear this word a lot. PRP stimulates the release of growth factors, and you're like, what's the heck is a growth factor and why do we keep talking about it? So a growth factor is a substance, like a protein or even a hormone, that stimulates other cells to do something. So these growth factors are associated with healing soft tissues, so it could stimulate the healing of a tendon or a ligament, or even abnormalities in bone or cartilage. So these growth factors come in and they're trying to stimulate these other tissues to do something. In addition, platelets also have been recognized to have antimicrobial properties as well. And so once we inject a lesion or a joint with PRP, we think that the growth factors begin to do their job minutes after introduction into the joint. And over 95% of those growth factors are secreted within about an hour of injection. However, the platelets also continue to release these growth factors for several days. So it seems like there's an immediate effect, but there's also an effect, days later, which is what you want. So clinically, we know that PRP is used commonly in tendon and ligament injuries. So you may have had a veterinarian recommend this product for a lesion, say in the superficial digital flexor tendon or deep digital flexor tendon. And that will be often done kind of shown in this picture where it's guided by the ultrasound. Tendons and ligaments are known to have a poor capacity to heal, and that's specifically because they have a very low blood supply. And so to get growth factors and healing products and everything to come into the area of injury, the main way to have that done is to have it come in through blood supply. So if you have a poor blood supply to a certain area, your healing is going to be slow. So that's why we try to inject those lesions specifically to sort of directly deliver those growth factors to the area. And this product's also been gaining use for soft tissue injuries within joints as well, so things like meniscal injuries within the stifle, and for the same reasons. PRP has been utilized for osteoarthritis, particularly in humans as well, and it seems to have shown a positive response. So in people with knee arthritis or people that are undergoing shoulder surgery, they do show that they have reductions in their pain scores and improvement in their function. And in the horses, a few studies have been performed directly looking at PRP's use for osteoarthritis, but it does seem like in the few studies that have been done so far, lameness scores have been reduced following injection. So it seems like a promising treatment as well. So this is another product that I wouldn't say it's new now, but maybe when I was an intern, it was sort of coming up the pipeline as a newer product. It's called autologous conditioned protein, kind of sounds similar to autologous conditioned serum, which is IRAP, but this is called ProStride. So autologous conditioned protein is another blood-derived product, so we're going to pull it directly from an intravenous blood draw. And it's been investigated for use, again, in osteoarthritis in humans and horses. So it's similar to IRAP in a way, because it concentrates the IL-1 receptor antagonist, the bodyguard against that destructive IL-1 protein. But in addition, it also concentrates white blood cells, platelets, and plasma proteins. So this is kind of starting to sound familiar. It sounds a little bit like IRAP and a little bit like PRP. So in the human studies that have looked at this product, they found high levels of the receptor antagonist and platelet-derived growth factors, there's that word again, but also another cytokine or protein, whatever you want to call it, called IL-1 beta, another cell signaling molecule. So there's a lot of sort of deep science involved in a lot of the research for these. I'd say there's been more limited studies looking at the product so far in horses. They haven't evaluated how this different IL-1 beta might affect horses and be beneficial. But in humans, there's been significant improvements in lameness grade and joint range of motion so far with just a single injection of ProStride in the studies that have been done. And I would say one distinct benefit to this product is that you can draw it, it can be processed within 20 to 30 minutes, and then you can do the treatment right there in the same appointment. No incubation necessary, but you still have some of the same benefits as the IRAP product. And this product, I would say anecdotally, has also been used in tendon and ligament injuries as well as joints. All right, hopefully I haven't lost you guys yet, but we're moving on to stem cells. So equine adult mesenchymal stem cells are harvested primarily from the horse's bone marrow. So this is different from all our other biologic products because it's coming from the bone marrow, not the blood. So it's a different harvesting procedure. It can also be collected from fat tissue. I would say that that's done a little bit less commonly in everyday practice. So most commonly, you're going to either collect it from the sternum, which is shown in that picture, or you can collect it from the point of the hip. I would say the collection of this product is probably going to be carry the most risk out of all the biologic products. So people that do it all the time, it's safe in a way and someone who knows what they're doing, but collecting blood from the sternum of a horse does carry more risks than pulling blood from the jugular vein. Typically, the bone marrow sample will be cultured and expanded, which increases the total number of stem cells that you pull. So you pull 5 to 10 mLs of bone marrow aspirate, and then you're going to send it away, and it's going to expand it, and say maybe if you started with 10 stem cells, you're going to end up with 10,000 stem cells, just for example. So stem cells, why do we want to use them? Well, they're able to replicate and differentiate, or basically turn into various different types of mature cells. And this is important during the process of tissue regeneration after injury, because we want to form the type of cell that is injured. We need more of that cell and a healthy version of that cell. Stem cells are also known to secrete a variety of growth factors and cytokines, so cell signaling molecules. And they also have potential anti-inflammatory effects, capable of reducing inflammation and then influencing regeneration of those tissues. In the normal healing process of tendon and ligament tears, there's typically a normal sequence of events. So you have injury, inflammation, and then you have to start rebuilding tissue and remodeling that tissue to become normal again. If you just let that process happen on its own, we've all probably had this happen with a cut, or maybe you severed your own ligament. The tissue at the end of the day is never going to be as good as what was the original tissue. You're going to form scar tissue. And the problem with scar tissue is that it's inelastic. So if I put a deep digital flexor tendon normally next to scar tissue within a deep flexor tendon, this one's going to be elastic and this one's going to be very stiff. So the problem with healing of tendon and ligament injuries in general in horses is they're always going to be at a higher rate of re-injury at the point where that scar tissue meets the normal tissue, because they don't move in the same way. They don't have the same capacity to flex and extend and move. So it's believed the main mechanism of stem cells is not simply through their ability to become different cell types, like tendon cells in the case of tendon injury, but the signaling molecules also can stimulate an improved healing process. And the purpose of trying to use stem cells to create these new tendon tissues or what have you is to create a tissue that's more like the original one than scar tissue, if that makes sense. We've also had a lot of research looking into stem cells for healing of articulate cartilage lesions, which is an ongoing area of research. I would say it's, the research is variable in the results. And what's the most successful way of delivering stem cells? Is it putting it directly into the joint? Is it utilizing that sort of anti-inflammatory soup again? And injecting that into a joint? I think the problem is that we don't really know. So we're trying to work off of the information that we have. And finally, this product is called alpha-2 macroglobulin, or some of you may have heard of it as alpha-2 EQ. And I would say this is probably one of the newest products that we have started using. Basically speaking, it's a naturally occurring protein that's within the blood and within joints itself, but within the articular joints, it's in a low concentration that's not effective enough. So that's why they've started to try to increase the concentrations that we have in the joint. And this little diagram is essentially from the website, but it works by trapping inflammatory molecules, which they call proteases. It baits them, it traps them, and then it moves it out of the cell. So initial research into this product seems to be fairly promising. There's been improvements in lameness, improvements in patient comfort following treatment, although they seem to be finding that the horses that respond to more than one injection, so they require more than one treatment, which isn't necessarily unusual for a lot of these products. But I'd say this has been our veterinarians' experience so far as well, as the ones that have responded well to multiple injections, and some horses just don't respond. So that's kind of how it goes. But this is another one that we've started using as well. Okay, so we've made it to the end. Hopefully that wasn't too much science. But I think the biggest question is now, what product do I use? There's all these options. How do I know which one is the best? And I don't think there's a straight answer, honestly. It's going to depend on the specific problem that your horse has. Is it a soft tissue injury? Is it joint inflammation? Is it a combination of both, which is often the case? What's my veterinarian's experience and their preference? So, for example, some veterinarians say they have really good success using PRP and they're comfortable using that, and they seem to have good results, so that might be why they use it, which is fair. The other thing is what products are available. So we have these products listed available to us at our North Clinic. Some of them have to be done in the hospital, some of them can be done on farm, and so that might make a difference. Or if you have a veterinarian that you normally use on the farm that's different than us in the hospital, they might only have access to a certain number of products. I would say another question is, what does the research say, which is ever evolving. And then the golden question is, how much money do I want to spend on this product? All of our orthobiologics, I would say, are going to come at a higher price point than just your average joint injection with a steroid. And that's just because of the cost of the product to us, the cost of having the equipment, what have you. So I didn't include all the different costs of each individual product. They do vary based on which one you're using, but that's going to be another factor to keep in mind. And that's everything. Does anyone have any questions? Yeah. Yeah, so every single product is a blood draw except for stem cells. Yeah.
And the last thing is blood draw?
Correct.
And could you speak to feeding for like glucosamine and collagen and all that stuff? Are we wasting our time with that?
Yeah, so the question was, are we wasting our time with basically oral...
Are we wasting our money?
Oh, money or time. Wasting our money or time with oral products. And I guess, yeah, that probably could honestly be a completely separate conversation. I think there's probably a lot of products that don't have a lot of research behind them. And so it's all going to depend on how much of that product, once the horse eats it, it goes through their entire digestive system and through the liver a lot of times for processing, how much is left and actually makes it to the area that you want it to go, which oftentimes is joints for a lot of what we're treating. I think, personally, I could probably give a couple different examples of products that have good research behind them and seem to have good success, but I think you could go to the tack store and probably pick like 4 or 5 products off the shelf and you wouldn't know if they're gonna basically excrete it in their urine or their feces, 90%.
Which ones have data?
So Platinum Performance, which I think we're going to talk about later, does do like good research based behind all of their products. And then there's Equine is another one that I have used with some success and seems to do research behind. But I think some of our other vets in the building might even have some recommendations too. I don't know if anyone's strong feelings about anything. No one's jumping out. Yeah. Yeah.
So if you have flexions that are normal,
Yeah.
but on radiographs it shows an osteoporosis in the joint, is there any preventive measures you should take, or should you just monitor?
So the question was, say you have a normal lameness exam or you have normal flexions and the horse doesn't seem sore, but maybe on radiographs, whether you're doing survey radiographs or maybe they're pre-purchase, you find something like an osteophyte. Should you be doing maintenance treatment on that joint, or should you just wait and see what happens? And I guess that's a bit of a loaded question in a way. I would say it's very well known that the radiographs of a horse don't always correlate to the clinical picture. So you could have a horse that has terrible hock radiographs, seems like lots of arthritis, but the horse is comfortable. Alternatively, you could have a horse that actually has very inflamed hocks and their radiographs look normal. So it is a bit of a clinical judgment, I suppose, whether you want to treat that horse. I would say if, in your specific example, if you have, say, osteophyte formation in a hock, but the horse is comfortable, they don't have any joint effusion, so there's no extra fluid in the joint, they don't respond to flexions, I probably wouldn't be jumping to injecting that joint. There's could be different subtle changes that you might pick up on. So the horse maybe isn't lame, but they might have a fusion in the joint. So a fusion meaning increased joint fluid is always, I would say almost always secondary to inflammation of the joint. So then you know there is something going on. And in that case, you might decide to treat the joint and see what happens. Hopefully that helps. Yep.
And for stem cells, just as a curiosity, why did they choose to do bone marrow, external or pelvic or whatever, as opposed to like a dermal or a subdermal? Seems like a dermal or a subdermal would be less invasive and have less chance of.
You mean like collection
Yeah,
from
yeah,
subdermal?
why don't they use dermal and subdermal instead, or are they just inferior to using bone marrow?
I would say most of the research that has been performed in horses has either been from adipose tissue, so fat, or from bone marrow-derived mesenchymal stem cells. I can't say I'm an expert on the specific scientific research of all of the stem cell, research and why. But I would say going through all the research that I've done, I've never seen them discuss subdermal or dermal. The only other things that kind of come down the pipeline occasionally are amniotic. Or umbilical embryonic collection of stem cells, which is obviously a little bit more controversial in a way. But yeah, it's a good question. Do they do that in humans, or do you?
Yeah, there's huge numbers of stuff. It's easy to convert dermal and subdermal and to proliferate stem cells.
Yeah. No, I can't say I've ever read anything about dermal or subdermal in horses. So.
Just curiosity.
Yeah.
Less invasive.
Yeah. No, interesting. Yeah.
Shockwave in conjunction with whether it's radial or focal, is there a particular, like with IRAC or something different other than your peer, is there any contraindications to using radial or focal with that, the injections?
Not to my knowledge. I think we don't have a ton of research on specifically using the biologics in conjunction with shockwave, but I know a lot of people do it. So personally, I haven't read any contraindications necessarily. I don't know if any of our other vets that typically do biologics with shockwave have any other comments, or maybe some of our sportsmed people, but yeah, not to my knowledge. Yep.
Can you elaborate on Renovo?
I can't elaborate too much because, to be honest with you, I've never used the product. I know it is up and coming, used as sort of amniotic type tissue. The use of amnion is not actually a new thing. So amnion in itself we have used for wound healing products, even healing of corneal ulcers in eyes for a while, and it does have definite wound healing capacity, or at least capacity to help tissues heal. I've never used it personally. I know that it's kind of out there right now. I haven't seen too much in the research about it yet, but it's one of those products, in addition to others that seem promising for sure. And sorry, that was for Renovo, it's called. It's another product. Yep.
Is there more research coming out on injections and the timing between them, etc., that if you're injecting very often, it's very bad for the horse?
Yeah, so the question was, what's the research showing on timing of injections, the frequency of injections, and is there detriment to injecting, if you're having to inject the horse more commonly, is that detrimental to the joint? I can't say that there's any specific research come out about it. I mean, speaking just from what we know, and I think a lot of that concern comes with the use of steroids in joints. Which could be another topic, but steroids, technically speaking, there's different steroid classes that we can use, and based off of research, we know that some steroids have chondroprotective effects, so basically they may even help the cartilage, I don't know if I would say regenerate, but it seems to have some sort of beneficial effect to the cartilage. There's a second steroid class that's sort of neutral. It doesn't really have any beneficial effects, it doesn't have any detrimental effects, and then there's a third class which seems to have more long-term detrimental effects to the cartilage, so maybe wears it down over time. So why would we even choose that one? Well, the thing is, the one that's really good for the cartilage, or better, lasts a shorter amount of time. The one that's neutral sort of lasts the medium amount of time, and the one that may be detrimental lasts the longest amount of time. So I think it's a little bit of personal preference, which steroid you put in which joint. The frequency of injection, I think, is going to be widely debated probably among clinicians. Personally, I think if you are starting to see that a joint is not responding to injection or you're having to inject them very frequently, and I think frequency is going to be a little bit of a personal opinion. To me, I would say if you're injecting a joint more than every 6 months, then it's probably not responding or not, really giving you the outcome that you want anymore, and you may need to look into other options. To the question of is it detrimental to the joint, I would say it probably could be over time, especially if you're using certain products that we know, may end up causing cartilage wear over time. We might use those specific products in joints that we know are more apt to fuse on their own, so like a lower hock joint, we might use this product that has potent anti-inflammatory effects. It's important to reduce the inflammation in those joints, so it's not a bad thing to use these steroids. They have a very important role in reducing inflammation, because we know inflammation, as discussed today, is very detrimental to the joint itself, but we just need to sort of clinically evaluate and really think hard about the where we're trying to go with the purpose of our injections and what the outcome is going to be, if that makes sense. Yep.
We have a pony that clicks when he walks.
Yeah.
Any reason why? He's
So,
not lame.
pony that clicks while he walks, and he's not lame. The only thing that I've sort of thought about anecdotally with that is could there be a tendon or something that's sort of snapping
Right.
off of where it's sitting, or maybe it's a joint or the soft tissues associated with a joint that are sort of moving and potentially just sliding in such a way that they're creating a clicking noise. If he's not sore and he's moving okay, I probably wouldn't worry too much. I think a lot of horses would hear the odd clicking noise when they move, and it's not too big of a deal.
Right.
Yeah. Anything else? Yep.
Where does the OSPOS fit in all that?
OSPOS. So yeah, OSPOS is another product that is an injection. It's usually an intramuscular injection. It's a completely sort of different treatment. It's basically a bisphosphonate medication that I think originally used in osteoporosis in humans, so people that have low bone density. It reduces, we're getting more science again, osteoclastic activity. So osteoclasts eat away bone, or basically are responsible for destroying. Osteoblasts build up bone. And both of those things are very important when you're talking about bone remodeling, because for bone remodeling, you have to get rid of some bone and form some bone, and they work sort of simultaneously together to create the end result of bone. So in the use of bisphosphonates in people, the purpose is to increase their bone density by reducing the eating away portion of the molecule and improve the building up portion of the molecule to increase bone density. So the use of OSPOS initially was used for navicular bone disease in horses, and I think probably where that came from is in a lot of those navicular bone lesions we start to see big cysts where we have loss of bone density within the navicular bone itself. So for the same reasons, the product was used to increase the osteoblastic activity within the bone. It's also been shown to have some sort of I don't know if I call it anti-inflammatory, but pain relieving effects as well. So I would say now OSPOS is used a little bit more generally by some people for bone pain, and I don't know if we necessarily know if that's helping or not. There has been some controversy with OSPOS use in young horses, because as horses are growing, which occurs up till they're 6-7 years old in terms of bone remodeling, they need that balance between osteoclasts and osteoblasts to properly develop their bone. So if young horses are beginning OSPOS, then it could be interfering with that. And especially in the racehorse industry, there was some concern about fracture with horses that have been given OSPOS. This is a whole other can of worms, but that's sort of the general spiel. Anybody else? Oh, he's shutting it down. So.
Okay, so we'll keep on rolling, and with our next talk, and then we have our lunch break right after. So next up, we have the legendary Dr. Catherine McDonald. She's going to kind of go in a little bit of a different direction. We're going to talk about acupuncture and some of that aspect of treating lameness issues and overall performance issues. You know, Janet's talk was really good, and I've been around long enough. I'm pre-IRAP, pre all of that stuff, and we just had cortisone and steroids, and you know, I really think in the next 10, 20 years, there's so many new products coming and so much more research that things are really getting fine-tuned, where I think there'll be a point where we very rarely use steroids, and we'll have all of these kind of more natural type products that are really quite useful and beneficial. All right, take it away, Dr. McDonald.
Okay, thank you. We're going to get a little less sciencey. I'm going to do my best to not get too woo-woo on you. But this is an alternative therapy, so we're pulling away from the drugs that Jenna just did. Such a beautiful, you guys asked a lot of hard questions. Let's take it easy, we're going to have lunch soon. Okay. So first off, acupuncture's been around for a very, very, very long time. So at least 3,000 years. It's an old Chinese medicine. We know it's been around. They used to use like stone needles way back in the day. They found it, you know these things. Anyways, so the first kind of document that they found is in this Yellow Emperor's Classic of Internal Medicine. This is all human stuff. In the 1680s, there's some talk about Europeans that would come over, but it kind of been doing this through the last 3,000 years in terms of whether people believe in it or not. So the Chinese have always believed in it, but in the last 40 years, it's become really, really like human medicine is very big on the research, how it works, and integrating it into Western medicine. So horses actually, you know, they have like found all sorts of stuff where horses actually were treated with acupuncture way back in ancient Chinese because they were really important to their everyday farming life and in war. But we don't get any formalized textbooks until about the 1970s for veterinary acupuncture. So how does it work? We're getting to know more about it, but there is still a lot of it that is, we know it works, but we don't really know how. So the acupuncture point locations, so they're all over the body. Like there's hundreds and hundreds of them. So they're kind of more important, really powerful points are really close to blood vessels and lymphatic systems that are surrounded by small nerve bundles. Some of them are really close to high density free nerve endings. So basically that means you're getting really, really close to the nerve itself. And mast cells. So mast cells are responsible for like histamine release, or they're also close to a motor point. So what a motor point is you have a muscle spindle, so like the front, like your bicep, sorry, mine are small. You have one here, like the top of it's here and the top of it's there. There'd be an acupuncture point like right here. So it's like right where the tendon is going to meet the bone. So why is this? Yeah, I have lots of pictures and videos. It'll be nice. So why would I care about doing acupuncture on your horse? Well, there's minimum unwanted side effects, as long as you know what you're doing. So as you can imagine, there's lots of joint, acupuncture points that are like, say, over a joint. I don't want to stick a needle into your horse's joint unless we clean it and, you know, all that stuff. Or there's some that are on their abdomen, actually on the bottom, we don't put needles there, or in their back that are close to some structures that you're not going to stick a 2-inch needle into. Incredibly, it's very well tolerated. So I could probably tell you about every instance where a horse didn't like it, and it's very dramatic, but for the most part, this is what happens. It's also drug-free. So we can use it on performance horses like right before the horse show. You know, if we have them already on a lot of medication and we need a little bit more help, this is a great way to do it drug-free.
lots of people want to maybe not use drugs in their horses, and so this is a great way to help them. So the effects. So what we do know about it is you get the release of beta endorphins, serotonin, which is like happy for, you know, people that need serotonin, and a lot of other neurotransmitters that you can get a local effect as well as a remote. So I can put a needle, say, in a foot, and it might affect somewhere else in their body, or you'll get a whole body systemic effect. So you also get capillary dilation and immune activation, and then your parasympathetic nervous system activation. So this is the opposite of your fight or flight. So that's like your you know, if you're fight or flight, you're not gonna, your GI shuts down, all that sort of thing. I'm gonna activate the other side so it's nice and relaxing. So what does this mean in the horses or in humans? Is pain relief is the big one. It's also anti-inflammatory, increased blood flow and microcirculation, regulation of GI motility, hormone and reproduction regulation, immune system regulation. It can be fever reducing. Also sometimes can affect their emotional state, which sometimes is very helpful in some of our horses, you can imagine. But how do I decide, basically, that, like, how do I decide where I'm going to stick needles? Well, first off, a history, physical exam. Sometimes we'll be doing a lameness exam, and then I'll decide, okay, maybe we should try acupuncture in your horse. This is where we're going to get weird. Okay, we'll do a tongue and pulse diagnosis. So this is the Chinese medicine side of things. So tongue and pulse will tell us about the qi. Qi is your life force. I'm sorry. I won't go really deep into this because it is a little bit like, it's difficult to understand. But basically it can help us determine which points we're going to use. And also, so like if their tongue is red, it's an acute point. If their tongue is purple, it's more of a, like their qi is not healthy. Anyways, so the biggest part of what we're doing though is the acupuncture exam. So this is just a picture. These are all the diagnostic points in a horse. So I just put this in here not so much to tell you where all the diagnostic point is, just that there is a lot. So I get a lot of information from just running over like the palpation of those diagnostic points to determine exactly what's kind of going on in the horse, and then also where I'm going to pick points. So picking points can be interesting. And where, this also gets weird. So the meridians are, there's 12 paired meridians, and they're based off the Zhang Fu organs. So as you can see, these are organs we recognize, right? We have lungs, we have large intestines, we have spleens. It doesn't necessarily mean that there's something wrong. So say if I put a needle in lung 1, your horse's lungs are probably fine, but it's named for, this is where the ancient Chinese medicine side of things comes in. So you might find that I'll be like talking, I'll be like, oh, I'm gonna put this in bladder 13, and you're like, my horse's bladder's like not functioning? No, it's fine. There's also 2 other non-paired meridians which run along the top, so the top and the bottom of the horse. So there's a bunch of different types of acupuncture that you might encounter. So probably the most easiest and where we start with everything is dry needle. So you insert basically one of these acupuncture needles into a specific acupuncture point, and you're going to get basically stimulation of that point to some degree. So what we would use this for is if, say, we're kind of treating something more on the Chinese medicine side of things, or say the horse can tolerate having the electrodes on, we're going to learn about that next, or if it's their first time. So sometimes they just, it's weird, they feel things. I don't know, has anyone had acupuncture themselves? Okay, so you know, sometimes it does, your body gets heavy, sometimes you cry, sometimes you laugh. Well, a horse can't cry or laugh or feel heavy. So it gets weird. Anyway, so this is probably one of the more common things we do. So these are just a couple pictures of the acupuncture needles. The typical ones I use are about this long. And we have some shorter ones for like their face and their legs and that sort of thing. So if we're treating, say, more of a painful condition, what we'll do is we will hook up
specific acupuncture points to electrical stimulation. So this is not a zap, not shocking your horse. It's more like a hum. It's like low frequency, and it overstimulates the acupuncture point. You get a ton of pain relief from it because basically what you're doing is modulating the nervous system, telling the nervous system it needs to settle down and it needs to just be okay. So here's a couple pictures of what it looks like. The different color wires don't mean anything. It's just so that I know what I'm attached to, basically, so I don't mix up what I'm trying to do. Because they won't feel the electrical stimulation unless you're hooked up to 2 needles. So they need both to connect to complete the circuit. Another kind of acupuncture, which is pretty, oh sorry, I forgot I had videos. Maybe. Okay, this is what it looks like. This is why I like this, because the horse loves me. And this one I put in there because I mean that pony is adorable. Yeah. Very cute. Sorry, I forgot I had videos. Okay, so another kind of common one that you'll see is acupuncture. So this is where we actually inject something into the acupuncture point. So this is a little bit different because we're not using acupuncture needles anymore. We're using regular hypodermic needles, which is like what we normally use for every kind of, it's like an intramuscular injection. So we're injecting medication into the acupuncture point. So the reason why we do this is it'll stay there a little bit longer. It sits on the acupuncture point longer. If the horse cannot tolerate having needles left in its body, this is when I'll do that. I don't particularly like doing this in horses that are really, really muscle sore because they will grab the needles and you're at risk of needle breakage. And you really don't want to break a needle off a horse because then I gotta go see Jenna. And then you don't like me anymore. Other thing too is if you have a horse that doesn't tolerate having needles in, so I can sedate them to do this. Whereas regular acupuncture, you don't really want to sedate them because what sedation does is it tells the nervous system to calm down. Well, then you're not going to get an effect from acupuncture. So other times that I'll use this is if, say, the horse is going to go to a horse show, but it's in California. So it'll see me before it goes, and then it'll kind of last, and so it'll stick in there. And the things that I usually use are B12, saline, or injectable Tramadol, which is just it's like arnica stuff. It's anti-inflammatory, non-drug, basically. The last type of acupuncture, not as common, but basically it's another way to stimulate the needle. So basically what we do is we stick a herb called moxa on the end of the needle, and we light it on fire. And then it doesn't stay on fire, it just smolders, but the needle will get warm. It's not hot, so it's amazing. The first time you ever see this, you're a little awestruck that the horses stand for this. I got a video, don't worry. And the needles are warm. They're not hot. They're just warm. So you're increasing the heat. So that, again, this is where your Chinese exam part comes in. So a lot of times when we're doing this is we are treating stuff like this horse who is covered in hives. And so, cool, eh? I know. And look, this horse just stands there. And I've never had a horse that doesn't like it. It does smell like marijuana, so you have to be really careful when you're in a barn. I did it once. I was at a horse show doing this in Florida, and a bunch of the grooms walked by and thought anyway. Doesn't matter. So this horse in particular is being treated with steroids and all the other things we do to treat hives. This is to help because you can see how bad it is. This horse is this is just one particular case. It's really, really bad. So, why do we want to use it in performance horses? The biggest thing is it's a drug-free alternative. So this is very important for, say, our FEI level horses who can't have medication, or perhaps are just regular sport horses that are already on medication but need help, or they are just really, really muscle sore and they need help, and we need to make them feel better so that they can compete. Some of the things that we treat, and probably the most common ones, is just overall whole body muscle soreness. So we get like that when we ride a long time. Horses do too. Back and neck pain is probably the second most popular thing we treat with it to help them. And I've had a horse that even came into the hospital because had bad neck pain, acupunctured, and the thing's like jumping around. So it can really make a huge difference. And then just horses that suffer from osteoarthritis. So that's our older guys that have been horse showing, campaigning forever and ever and ever and need just that little extra help. Some other uses that we might use in performance horses or other horses is nerve paralysis. So if they say have facial nerve or their face is droopy, acupuncture can really, really help because it's overstimulating the nerve and we can get that nerve to look better so that your horse, your nice show horse, isn't going around with a droopy lip. The other thing is just GI motility and regulation. I don't typically like to use it, you can, but I don't typically like to use it in like an actively colicky horse because sometimes you make things go a little too fast before the horse is ready. But for say a horse that suffers from chronic colic, or has had colic surgery before and just needs like a little bit of help with motility, I really like it for that. And then immune disorders. So, a lot of our show horses can't show on steroids. So if they've got bad hives, you gotta send them in the ring with their hives. However, we can help them hives go down. Very rarely can I make them go away, but I can make them look less ooey. The other kind of happy side effect of this is it's very relaxing, as you guys have seen. So for horses that suffer from show anxiety, we can help them relax a little bit. We do it a lot in hunters to make them quiet. But it's just sort of like it's a short-term thing that it just helps them relax. So some of the like big show jumpers will get done kind of the day before they'll go in a big class. So the horse is nice and relaxed and loose so that they can go and do their best in their performance. There are some times we just should not do acupuncture. One of them is pregnant. Do not acupuncture a pregnant person or horse. It's not good. If they have a fracture, we're not doing that, okay? Or if it's infectious, so say they have like a cellulitis or something, I could make it really bad. So there's just times where what Eastern medicine does not help our Western medicine. Another time is open wounds. There's just, sometimes acupuncture is not the right answer. We do have several doctors that are certified in doing this, little plug. I wasn't going to put my name up there and then I felt weird, so that's why. My husband was like, they know you're certified in it. And I was like, yeah, it just needs to be up there. Anyway. So we do have lots of doctors that are certified in it if you guys are interested. So, any questions? I love cute videos and pictures. Yes, go ahead.
So I go for acupuncture regularly as part of a healing plan kind of thing. But for horses, if you're just doing it for comfort, what's beneficial? Is it I assume it would be more than what we'd want to maybe pay for on a regular basis.
Yeah, for sure. So I think if I understand the question, I don't know if I really understand what you're
how often
How often would you do it?
beneficial,
Okay, yes, okay. So
because I have benefits, but
yes.
my horse doesn't.
Yes, fair point. So it depends totally on what we're trying to treat as how often I'm going to want to do it. So for, say your horse's back is just say your saddle doesn't fit. Here's a good example. Horse's saddle doesn't fit. Your horse's back is very, very sore. You get the saddle fixed, but their back is still very sore. We're probably going to do it once a week for 2 or 3 times. And that's to help kind of get through. And then based upon how they respond from that, we might do it on a regular basis, like once a month, or maybe just when you go to a horse show. So it really depends on how sore the horse is, what we're trying to treat. So in that case, the horse's back is inflamed, it's upset, it's sore. We need to calm all that down. But I would say there's a few horses that'll do like once a month. And those are particularly special cases and owners who want to do that. But, and like if it's a chronic condition, we're probably going to want to see them every couple months. Yeah. Yes.
What's the benefit of the saline?
So the saline, you're just asking the benefit of the saline for the acupuncture. So the benefit of the saline is usually to dilute what we're putting in, so you're not like B12. If you put too much B12 in them, you're giving them too much B12 and they will be wild, right? They'll get energy. Not all the time, please don't go out and give our horses all B12. So you put saline in to cut it, so you can use more, like very rarely will we just put saline in. I do know some doctors that'll put like DMSO with some saline. It's just like kind of preference, but that's usually what the saline's for, is to cut your medication. So, yes.
So I've had Chinese acupuncture and my physio does I don't know what it's called, dry needling. So do we do that with horses, or do we just stick with the Chinese meridians and that theory? Or
Yes.
or is it just too painful to stick a needle in a horse's?
Yeah. So you're talking about when they stick the needle right into the muscle belly? Yes. Yeah, and twist it, and then the muscle goes.
Well, that's what they do to
Yes.
me.
Yeah.
Right?
So you can do that in horses. I guarantee you will get kicked in the face. So
We just don't do that.
not really, and it's mostly because again, a horse does not tolerate that kind of. Some special horses do, and honestly, sometimes the acupuncture point is so close to, like what I was saying, like there's an acupuncture point like right here on us, that when that's tight, it hurts. And it's the same in horses. So there are times where you get a point that is really sensitive, and you'll actually watch, especially in their like lumbar back. You have to be really careful where you put the needles. Like I might sometimes have to put a point in front and behind a particular muscle belly because it's just too painful to put in. And acupuncture is supposed to be a pleasant experience. And like I can yell at my physio and tell her I hate that. Horses can't do that. So.
But it could release.
Yeah.
Not just, it could cause a release.
Yeah, and you'd be amazed at how much it overlaps that muscle. Like you'll pull the trigger point out by doing Chinese, basically, meridian acupuncture. Yeah. Good question.
So, horses that get hives.
Yeah.
Is that not usually from fear? Like is that why you would do acupuncture before they would do a show?
Sorry, say that. Hives?
Yeah, hives.
Hives, so hives are like an allergic reaction. So it, and when you're trying to, I guess, help them with acupuncture, that's the mast cell part of it. So basically, and this is where it gets a little bit less sciencey. Okay, so I'm trying to clear the wind in their body and improve their chi, as opposed to say what a steroid's going to do, which is decrease your inflammatory response. Does that make sense?
Horses usually get hives.
Yeah.
Normally, well, I guess an allergic reaction, but I thought maybe, is it like from stress?
Not typically from stress itself, more an allergic reaction. But yeah, allergies in horses exist. Yeah, it's pretty common, I would say, and very frustrating, just like it is in dogs. Also, it's very expensive to treat horses with Apoquel. Any other questions? Oh, one more, okay. Yeah, you.
General,
Yeah.
so do I call more and ask for somebody to come do a acupuncture assessment on my horse? Do I specifically ask that? Do you then determine what you're gonna do, if it's even gonna work? And how much does that cost? And is it in conjunction with some other kind of veterinary treatment?
That is a beautiful question. Thank you. So yes, you call us and say you're interested in doing some acupuncture. And what's really great about getting a vet to do it is that if we assess them and we're like, this is not a problem that I can fix with acupuncture, you have their vet in front of you. So you're going to, we can decide whether or not, okay, no, actually I need to do a lameness exam, not an acupuncture exam. So if an acupuncture like treatment is about $185, so that includes your exam and the treatment. So, and usually what we do too is if I have to do, say, subsequent treatments, so say I need to come out once a week or even twice a week for a couple times, the subsequent cost is actually less. So it's really that first initial time you're paying for the exam, and then I just know what I'm going to treat your horse. So, does that answer your question?
So is it done for well-being, or is it only done when there's an actual lameness problem?
No, I'll do it for well-being as well. So that's like more the chronic, I would say, horses that suffer from either like say just chronic arthritis. It's a maintenance thing. So well-being, like keep them as happy as possible so they keep doing what you need them to do. And yeah, just depends.
And just because of the chronic part, you said that it's not good to do it on a horse's cellulitis.
Yes.
But if they're not in an active case, can it be a preventative measure?
Yeah, so it's just a question about cellulitis. So probably you're talking about a horse that has kind of a fat leg all the time.
Yeah, or a lot of they have a lot of episodes.
Yeah, so as long as it's not actively infectious, you can help because you help blood flow and lymphatic drainage. But yeah, you just have to be very careful because I can take something that's like on the brink of being really bad and make it really bad. And then you'll have to spend lots of money. Okay. Lunchtime? I think we're good.
Okay, now we have our last presentation of the day. We don't want to keep you too long. So today, it's going to be about equine herpes virus. Last winter, there were some big problems with EHV1 in the show jumping world in particular. So we thought this was probably a good idea to do a recap of what was going on and what's the virus all about. It does affect all different disciplines. So we have Dr. Jillian Hannon, who's going to be presenting to us today. So she's another one of our former interns, similar to Jenna. She's from the Netherlands. She came to us, did her internship, then she went to Purdue University to do some internal medicine training, internal medicine residency. And we were lucky enough to get her to come back. And she's been with us for a couple of years now, 2-3 years. Yeah, doing a fantastic job. And so if your horse is, usually you don't see her unless your horse is really sick or has something weird going on that nobody else can figure out. This is the lady that can figure it out.
Thank you so much. Is that okay for soundness? Not too loud, not too soft? Louder?
Louder.
Like this? Yeah. Okay, that's very close. Well, thanks everybody for staying until the last talk. I know it's been a long day, but I hope that I can educate you a little bit more about equine herpes virus. My goal is to go from this type of person who is in an utter panic, and when we hear the word herpes, there is a collective gasp, typically, to go to happy SpongeBob and knowing that knowledge is power. So we really don't want to be in a type of panic state, we want to be in a knowledge is power state. I can handle this, I can deal with this, I know what I need to do. So the first question, I guess, that we're going to answer is, what is equine herpes virus? And it is also known as rhino or rhinopneumonitis in the literature, or sometimes people will just refer to it as rhino. And it is caused by equine herpes virus 1 and equine herpes virus 4. There are also other herpes viruses, like the numbers 2, 3, and 5. And the numbers 2 can cause respiratory disease, can cause also corneal ulcers and conjunctivitis of the eye. Herpes virus 3, we don't see very often, but it can be seen with breeding mares and breeding stallions in a venereal disease. And herpes 5 can also cause a respiratory disease, but those are typically not, again, part of the complex that we're talking about today. Some pictures. So on the middle one, or the first picture, is a picture of a mare that has recovered from the equine herpes 3. And if you have any brood mares, you can always look under their tail, and if you see some white discoloration of the skin, they at some point had the herpes virus. And then also we see quite a bit of equine herpes virus 2 corneal ulcers. So if you ever had a horse that had a corneal ulcer that just was not responding to your typical antibiotic treatment, it was probably also infected with the virus, and it requires an antiviral medication as well. So what I'm going to be talking about today is, of course, herpes virus 1, because that's the one that we are most concerned about. So the herpes virus 4 is also a respiratory disease. The herpes virus 1 is the one that can cause respiratory disease, but also in the rare instances, abortion, and then, of course, the neurological disease that we are all very scared about. So this is a picture actually of my own horse a couple months ago, who I found in the pasture with a very snotty nose. And luckily he was positive only for herpes 2 and 5, which is very common. And then he had actually a secondary bacterial pneumonia because of the virus itself. So the next question is, well, how does a horse get herpes virus? Well, first we need to know that herpes is endemic in the horse population. And just having gone through years of COVID, we kind of know a couple of things about viruses in general, and some of these words that we have been throwing around. So endemic basically means this virus is circulating in the horse population. It cannot be cured, you cannot get rid of it. Ideally, it is managed if a disease occurs. And of course, we want to try to prevent the virus from shedding and getting into other horses, or potentially getting spread through our own people. Basically, there we go. So what happens is young horses, as early as weeks to months in the first period of life, they get exposed to the herpes virus, and that herpes virus basically goes into their system and stays dormant there until it gets basically recrudesces, which basically means it becomes active all of a sudden. So we go from this latent stage, which basically means it's sleeping in your body, and then something like a stressful period has to happen. So either the horses are getting commingled with new horses, we potentially go to a show, we potentially have a long haul because we bought a horse from the other side of Canada, and then that virus can become active. And the horse can be shedding it without any clinical signs, or the horse can be sick with it, like the respiratory part of things. So unfortunately, herpes virus shedding can occur in horses that have no clinical signs, and it can occur in horses that have clinical signs. Transmission is through the respiratory droplets, so that's why looking at horses with respiratory disease is very important. The incubation period, which basically means how long does it take for my horse to get sick after my first exposure, is anywhere from 24 hours to 10 days. And they say the average is anywhere from 3 to 7 days. So we basically try to think about, okay, what could technically be the longest incubation period? Well, let's say about 10 days. So if my horse all of a sudden got sick, I'm going to think back at least 10 days to see what has changed in that in-between. Potentially a new horse came in, or something stressful happened, what have you. Then the shedding of the virus itself from the respiratory tract, or the nasal mucosa, can be anywhere from 14 to 28 days. And we typically see the longer shedding when we get into the parts with our neurological disease. So I hear this often when I ask people about vaccinations, for instance. Well, my horse doesn't leave the property, so he cannot get sick. well, that does not apply to, I would say, most infectious diseases that we see. For instance, tetanus. Tetanus lives in the soil. Your horse lives on soil. So no, that your horse doesn't leave the property does not matter. Same with the mosquito diseases, West Nile. My horse doesn't leave the property. Well, the horse doesn't need to go to the mosquito needs to come to the horse, right? So leaving the property is not always a saying that you say for certain infectious diseases. So same with the herpes virus. They probably already have it because they already was exposed to it when they were young. So one thing that I will talk about a lot, or say the word a lot, is biosecurity. So I wanted to get it out of the way in the beginning, so that everybody understands what I'm talking about when I say biosecurity. So the virus can live outside of the horse for several weeks if we don't disinfect appropriately afterwards. So if we had a horse with a snotty nose, for instance, we want to make sure that that stall got disinfected afterwards, after it has basically been recovered. And that we use either a Virkon or a bleach to basically disinfect the environment. When we are touching horses, we either wear gloves or afterwards we wash our hands and use hand sanitizer. And then also the respiratory droplets, or basically the snot, can sit on your clothes and you go to the next horse, the other horse nuzzles you for whatever reason, and then that horse is basically exposed to that snot that has the virus in it. So you can technically be a transmission route for the herpes virus as well. So potentially using protective clothing, a coverall that you take off again afterwards, something like that when you are dealing with your sick animals. When we are sick, what we want to prevent 100% is no nose-to-nose contact, because again, that transmission is through those respiratory droplets. We don't want to share any water sources, so water buckets, feed buckets, mucking equipment, because again, if a little bit of snot happens to fall on there and you have another horse touch that, or sniff that, or eat from it, we can potentially be transmitting the disease, even though we are trying to do the best we can to prevent that from happening. And then again, afterwards, after the horse has recovered, we want to make sure that we have cleaned everything, we have disinfected everything, not just the stall, but the outside area of the stall, and then of course all the equipment that we have used, including lead ropes, brushes, all that type of stuff that could have become dirty. So this is, what we have to do when we have a sick animal and we are doing, dealing with it afterwards. I would say most barns will obviously have their normal biosecurity, meaning when a new horse comes into the property, they won't just put it out in the field with the other horses, they will have it separate at the facility first for a little bit before they will introduce it to the herd. So sometimes people will not necessarily understand, but they're actually already doing biosecurity to a degree, right? And then again, if a new horse comes to your property, ideally you have it separated from your resident herd for 14 to 21 days, because we don't want that horse to introduce any new diseases to the resident population. So, like I said, I'm going to use the word biosecurity a whole bunch of times. Okay, so first, herpes virus 1 also causes respiratory disease. Most times we see this in the young horse, so less than 5 years of age, and our clinical signs will be cough, nasal discharge, fever, lethargy, and some decreased appetite. Typically it's pretty self-limiting, so they will get over it pretty quick. It's a virus, so again, supportive care is really what you can do, but we have to be cautious that the horse recovers in a decent amount of time, because what will happen, or what can happen, is if my immune system is depressed, because I have a viral infection, as well as the viral infection makes damage to the respiratory tract, its own immune system, we're going to potentially get a secondary bacterial overgrowth, and then we end up with pneumonia. So we want to make sure that our horse is otherwise staying healthy, and that we don't have any signs basically of worsening of disease, because then we might have to intervene with some antibiotics to prevent or potentially treat the secondary bacterial infection. Biosecurity. Then our second disease that we can see with equine herpes virus 1 infection is abortion. So the mare will abort the fetus, and most times this is without any prior signs. Not like a mare that actually is going through labor. You will start to see obviously the signs when the mare is ready to foal. In this case, the mare basically expels the fetus, and she actually doesn't really know that all happened. And it typically happens within the last 4 months of the gestation. What you have to remember is the fetus, the fetal fluids, as well as the placenta are all infectious. So herpes virus is everywhere. And it's obviously still active because it literally just came out of the mare. So we want to make sure that we handle that tissue correctly and that we again clean and disinfect afterwards. And we keep that mare separate from our other pregnant mares because that mare still needs to clean up her uterus and expel some more fluid, which will have still some active herpes virus infection in it. And then the last one that causes, or the last disease from herpes virus 1 is the neurological disease, which again, I'm trying to educate you so that you don't get into that panic state as best as possible so that you know what you're dealing with. So when we have neurological disease develop after the herpes 1, we call it equine herpes virus myoencephalopathy, or EHM is what you will see commonly on the internet. Basically what happens is that virus, instead of just being in the respiratory tract and causing respiratory disease, it actually enters the bloodstream and then it will go to the small blood vessels that are around the spinal cord, specifically in the hind end of the horse first. And there it will cause a whole bunch of inflammatory reactions. So going back to abortion, why do the mares abort? Same thing happens. Herpes virus goes into the bloodstream, but in this case, they go into the uterus blood vessels and cause the blood vessels to basically not be connecting to the placenta, therefore the mare aborts. So with the neurological signs, the virus chooses, we don't know why, it chooses to go to the spinal cord. So sometimes what can happen is, 2 options why your horse could have gotten this. A latent infection became active, because again, they have herpes. Or they were potentially exposed to a horse that has herpes and otherwise is fine, or maybe has a little bit of a snotty nose, and then your horse got a new infection. So the clinical signs of the neurological form are hind end weakness, ataxia and incoordination, which basically means walking like a drunken sailor. They can be urine dribbling or not producing any manure or small parts of manure. They can be dog sitting, like in this picture, or they can be totally recumbent, meaning unable to stand. Sometimes they cannot even sit in sternal and they are just in lateral. On the rare occasion, the cranial nerves can also be affected. And that basically happens if the virus travels forward. So the virus will attack the blood vessels around the spinal cord in the hind end, but then on occasion it can travel forwards and we will start to see more signs in the front end of the horse. So what do we do for treatment? Again, supportive, it's a viral infection. So we want to use anti-inflammatories. We will use antiviral medications as well. We will use some supportive care supplements like the Platinum Performance, which has extra lysine and zinc in it, which has proven to be kind of antiviral. We will potentially empty the rectum or the bladder if they cannot pee or poop on their own. And if they are recumbent, we have to assist them to stand in a sling, because a horse that is recumbent also does not have a good chance of living, because horses don't do well when they are down for long periods of time. And of course, we want to ensure that they're eating and drinking and potentially support that if they are not doing that. Now you ask me, well, what is the prognosis if my horse gets EHM? Well, in most cases, if the horse can still stand and is doing okay as far as neurological aspect, the chance of recovery is fairly decent, but it might take weeks to months to recover, because as you can imagine, all these nerves have gotten inflamed. And when we have nerve inflammation, it always takes a long time for those to heal. So we typically say after about 9 months to a year, if you still have neurological deficits, that's probably the best it's going to be. So your horse could potentially still be a little bit wobbly in the hind end. he might make a full recovery. Once horses go down and are recumbent, obviously the complications increase with that as well, and their chance of survival is fairly slim. So overall, given what has been described in the literature, about 50 to 60% of horses with EHM won't survive. So it's basically a 50-50 chance. So some risk factors of developing EHM after an equine herpes virus 1 infection is obviously having the presence of the virus. Oh, oops. Was that me? I don't think so. Can somebody help? Short intermezzo. Okay. So, risk factors of developing EHM after an equine herpes virus 1 infection is obviously having the herpes virus 1 virus present, having a fever, being older than 5 years of age. Females are more prone to developing this disease than males. The season is very important. We typically only see those cases happen in the winter and springtime. And then again, biosecurity risk. So if my biosecurity is not optimal, so potentially having shared equipment, shared stalls, and potentially having much more contact with new horses. So for instance, if you're at a show and you entered 5 classes versus 1 horse that entered 1 class, well, that horse that entered 5 classes has more risk because it's going to be there longer and it's going to be exposed more to other horses than the horse that entered the 1 class, if that makes sense. Unfortunately, again, as I mentioned, herpes virus 1 can be shed clinically or non-clinically, meaning a horse can shed it without really having any clinical signs, or a horse can really show clinical signs, as in the snotty nose, the fever, and such. About anywhere from 0 to 3% of horses are those silent shedders. So those are, again, the most difficult to find. So how do we test for the herpes virus? So if we're looking at the respiratory disease, fairly easy. We take a nasal swab and we send it off to the lab for a viral PCR. As you're also well aware with COVID, the PCR basically means it detects DNA of the virus. If an abortion happens to occur, we would like to submit the fetus and the placenta for a post-mortem, and we submit tissue for viral PCR testing again. And if we have a horse that we suspect has EHM, we submit nasal swab and blood again for the viral PCR. Why do we do 2 tests there? And that's because the virus can be in the blood and the virus can be in the nasal secretions. They can happen at the same time, but they can also happen after each other. So it is important to check both areas, basically, for the presence of that virus. Sometimes the first test will be negative because they're not shedding it yet. So potentially if you still have a high suspicion that your horse has EHM, you want to retest them potentially 24 to 72 hours after the first test has been performed to make sure that we're 100% negative, or potentially we get a positive later on. Some things that we have to consider when we are testing is we have to have the collection. We have the proper collection, we have to ship it to the lab, we have to wait for the lab to actually do the test and have turnaround times. And of course, all this will happen on the weekend or after hours, which means I can't submit anything until the following day, until the lab is open. So sometimes we're kind of in a crunch where we need to know if this is true or not, because we need to start doing our next steps. And luckily, More Equine currently has a in-house PCR machine that we're just starting to work with this company called Fluxurgy, who has been very gracious in educating us on doing these tests. So we now have the capability of testing some nasal swabs for equine herpes virus 1 in-house, and you get a test result within 1 hour. So super handy when we are in that, again, hopefully not panic mode, but in that mode where, yes, we need to do something, and we need to have some answers. So important to remember is, of course, how can we try to mitigate or prevent disease? And that is by means of vaccination. So if you vaccinate your horses quite often, or have been in the past, you know when we say rhino vaccine, we mean that's the herpes 1 virus as well as the herpes 4, and we are preventing, or trying to prevent as best possible, the development of respiratory disease. If you have brood mares or you're breeding, you know about the pneumobort vaccine. So that tries to prevent the abortion occurrence, and we have to give that vaccine in a 3-dose regimen at the 5, 7, and 9 months gestation. Unfortunately, there are no vaccines that protect against the development of the neurological form. But, as you can imagine, if we try to decrease as much of the risk of horses shedding or having herpes virus 1, we will also therefore decrease the risk of herpes virus myeloencephalopathy development. And sometimes you will have to check your vaccine requirements for certain travel, different provinces, different states, as well as for different shows, whatever they are recommending. So now we get to the more important part. What can you do as horse owners? Do you see what I did there? I added a little swoosh to it because it's very important. Do not take sick horses to shows, or anywhere else for that matter. Very important. That's really the first step that we can try to stop the spread, because that's what we want to do. Sounds almost like a COVID talk. We want to take our rectal temperature of the horse frequently. We want to know what is my normal for my horse. That just gives you an indication that when you take a temperature and it's not normal, you can extrapolate that and say, oh, in the past 3 days he was totally normal, but today he just looks a little bit more dumpy. I took his temperature and oh, it's a little bit higher. I need to keep a closer eye on that. And maybe the following day he will actually have a fever spike. I just listed again the numbers for fever. So a rectal temperature about 38.6 Celsius or 101.5 Fahrenheit. When we're at the shows, I would suggest taking rectal temperatures twice daily. And if a fever is noted, we should contact the show veterinarian or the management of the showgrounds immediately, so that further steps can be taken. That doesn't mean the horse gets carted off somewhere else and goes into a dark little barn somewhere by itself. That might just be, we're going to monitor this horse closely. Or this might be, we need to do some testing on it. Whatever the horse otherwise is showing, it needs to be examined. And then what can we do further at the show? Well, we want to limit our nose-to-nose contact with other horses as much as possible, especially those horses that my horse is normally not around, because they have different microflora, basically, they have different immune systems. So we don't really want to commingle horses that have not really been with other horses. Plus, I don't really know how healthy your horse is. I don't even know you. Ideally, we are not sharing water buckets, feed buckets, equipment, all that type of stuff. Because again, any of those respiratory droplets could be anywhere, and they could be so small that you cannot even see them physically. So trying to, again, mitigate that is the best possible. And then, again, thinking about yourself as well. So I'm not going to go along this whole row of horses and pat each nose because they're having their face out of the stall. Because again, now my whole hand is full of bugs and germs, and now I'm going to my own horse and I'm going to pet it and kiss it because it's my horse. But now I might have given it some type of disease which we don't want, right? And again, your clothes can act as fomite as well. So basically, the virus is still alive, we don't want it to spread. And then depending on where you are showing, there will be protocols in place. So for instance, the USAF, the FEI, Equine Canada, specific showgrounds, they will have protocols in place. And they should all be easily accessible on the website. If they don't have anything available, I would highly suggest that you ask and say, what is your protocol? What is the best, how have these stalls been cleaned? All that type of stuff. So that again, you are the one who has the knowledge. So I just want to discuss two examples and then we're going to be done. So this is an example of an outbreak versus a singular event. So this past February in 2022, there was a herpes virus outbreak at the Desert International Horse Park, and there were 1,800 horses on property. It's one of the biggest horse facilities in North America, potentially in the world, I'm assuming. So I cannot even imagine 1,800 horses in one property. What happened there is 3 of those horses got the neurological form of herpes. Subsequently, 1 was euthanized. And then about 26 horses had herpes virus 1 positive tests, and they had fevers, but they did not show any other real signs of disease. So the showgrounds had to implement quarantine, they had to implement testing, and they of course had to implement retesting. During that time, we have to put everything on hold, and we need to quarantine the whole facility, and that's because of the herpes neurological disease. If this was just all herpes 1 with fever and maybe a little bit of respiratory, nothing would have been different, nothing would have been quarantined. But because the neurological form was diagnosed, that's when the quarantine starts to come into play. So after 5.5 weeks, finally the quarantine was lifted, and the horses that were still there could travel back to their hometown, or they could potentially start their circuit again. And then I would say about 2 years ago, here in the area of Calgary, we had a commercial boarding facility that had about 20 to 25 horses. 1 horse developed acute signs or acute neurological signs and was subsequently diagnosed with equine herpes myencephalopathy. We obviously had a quarantine in place for the whole barn. We were checking the barn, we were checking all the horses. We had an info night for all the owners that were there to make sure that we were open and honest about communication and to answer any questions that people might have had, because again, knowledge is power. Luckily, no other horses were affected, and the quarantine was lifted after 3 weeks after the last exposure, which means the last exposure that horse was still on the property. And just to come back to the Desert Horse Park, those are just the numbers for the Desert Horse Park. If you have watched the news at all, you know that there were many more horses affected. And that was because horses left that property before the total quarantine was in play. So actually in the total area of California, there were a total of 11 horses with neurological disease, of which 6 were euthanized. And a total of 105 horses were diagnosed with herpes virus 1 with just fevers. So it can have a much more, ripple effect, a water ripple effect, if you will, if you cannot stop it or if you don't stop it because you're not paying attention. The Desert Horse Park has been working with UC Davis as well as the USAF and has implemented a great deal of change, and they have updated their protocols, and I would say they have currently the best protocols in place to mitigate this and prevent this from happening again. So, my last slide, some take-home messages. Equine herpes virus is mainly a respiratory disease, but in rare instances it can develop into abortion or the neurological form. We are all in this together, prior to the show, at the show, as well as after the show. Education and awareness is key. Communication is key as well, between the grooms, the riders, the groundspeople, the management, veterinarians, state veterinarians. Everybody needs to be on the same page as far as it comes to finding horses that are sick, dealing with those horses, testing those horses, and implementing further steps along the way to prevent disease from spreading. And again, biosecurity. And then one more slide actually is the resource slide. I don't know if you heard about EDCC. Who has heard about EDCC? Oh, that's very slim. So the EDCC is a website that lists all the infectious and contagious diseases that horses might get from America as well as Canada. So it's a good website to see what is happening potentially in your area. You can either just look on the website and click your state or province, or you can sign up for a newsletter, obviously specifying which state or province you want to get updates from. Interestingly, after somebody uploads something to the EDCC, so typically that's the state veterinarian or veterinarians, we say, okay, yes, we have a horse that has the neurological form, we have one horse that has the disease, we have 20 exposed, they are in quarantine right now, the rest is pending. The horse.com will pick that up and they will put out some more news about it. So they will write that little blurb about that specific case, and then again they will educate people with giving information about herpes. And they do this with all diseases, so strangles, West Nile, rabies, all those things. So very helpful, because I feel like people will know the horse.com more than the EDCC. And then another resource that is good to look at is the resource from the American Association of Equine Practitioners, or the AAEP, which is basically a massive governing body that gives you all the information that you would ever want as a horse owner. So they have, obviously resources on other diseases as well, but they have a whole fact sheet, they have protocols, basically anything that you would ever want to know about herpes is in there, probably more than you want to know. But so those are really two good resources that I would definitely check out, especially when you are a person who is, having a sport horse, going around shows, potentially going to other places to train, what have you. And again, like I said, your horse doesn't have to leave the property to get this disease. Thank you. Okay, any questions? Yes.
Any evidence of is herpes transferable to humans?
So the question is, does the equine herpes virus transfer to humans? And the answer is not that I'm aware of. People obviously can get herpes as well, so it's the human herpes virus. So we can see cold sores, we can have shingles, we can also get venereal disease, but it's not the same virus. They're called herpes because they are the same makeup, but they're separate pathogens. Yes?
So let's say, for example, one of your people is sick and they spread it to other horses, your other horses, and you treat them with antibiotics, but it comes back. Is that always going to happen? So when you're saying shedding, does that mean like getting rid of the virus? Is that correct, or?
So let me kind of rephrase your question. Is okay, my horse got sick, my other horses also got sick, kind of now what happens? Will they get it again, kind of thing? Is that kind of how I see it?
They're also outdoors.
And they're outdoors. Yeah. So basically, if the one horse gets sick, whilst we are getting sick, we're going to also increase our immunity, right? So if I'm going to see that virus again in a short period of time, my own body should have mounted an immune response to it, so it should not get sick again from the herpes virus. Same as if you vaccinate. If I'm vaccinated and I see that herpes virus, I probably won't get sick because my immunity is top notch, or the best it can possibly be. Now, if my horse for whatever reason is immune suppressed, it's young or it just traveled a whole bunch, even though it is vaccinated, it could potentially still get sick. So when we get the herpes virus, it will stay in our body, and over time, so let's say as a 2-year-old, it had a snotty nose, had respiratory disease, it had herpes diagnosed. Now we are 5 years old and I have a snotty nose again. Well, could that be the herpes? Could be, because it potentially woke up in the body and I'm starting to shed it. I'm probably not going to be as sick. I might have a little bit of a snotty nose, but I'm probably going to have a fever, the cough, the lethargy that I had when I was 2 years of age, because I had some immunity built up, if that makes sense. Did I answer that?
So how often do you recommend you should vaccinate them?
So basically, according to the AAP guidelines, so I follow those. So when you are starting your vaccination, you always want to start with your introductory course, right? So you vaccinate, then 4 to 6 weeks later you do your booster, and then you follow it on every year from there.
Every year?
Every year. And then for specific riding affiliations, like the FEI for instance, they will require that you are vaccinated every 6 months or every 4 months or whatever they decide the rule is at that moment. So it depends a little bit on, again, what do you use your horse for? But I would say if they are just at home and you pleasure ride them, you go to maybe some trails, but you potentially meet some other horses, you know, all that type of stuff, then I would say a yearly vaccination is going to be adequate to the best of your ability, right? Yes, in the back.
So a quick question, when you're covering biosecurity, after you've cleaned a stall of an infected animal, you're cleaning your utensils and are you separating your manure piles? Are you taking that manure to a different pile? And if so, how long is it still live?
So the virus lives in the outside of the horse for several weeks. It also gets killed by sunlight. So if it's dead of winter, there's not going to be a whole lot of sunlight. So that virus will probably stay alive for more weeks than in the middle of summer, where it will probably get killed in a matter of days. So I would say several weeks. I would guesstimate 2 to 3 weeks. So if you, depending on what you do with your manure, if that manure just goes to a pile and that pile gets picked up and horses are not exposed to that pile, then you can mix your manure. If you potentially use that manure to spread it on your fields, well again, as long as several weeks have gone past that, it should be fine because there should not be any virus there anymore, right?
And you still, at that stage, you're also ensuring that your footwear is being cleaned also, because so you don't cross-contaminate.
Exactly.
Anybody who's there, your dogs, your whatever, they're going to the manure pile.
Exactly, and again, sometimes that's a little bit tricky when we have dogs and cats running around. Those are also fomites, right? Because the horse can snort on the cat, and then the cat can curl up on with the other horse, right? We see that often where people actually find it funny that the cat is curling up with the horse. But do we really want that? In my opinion, no. Yes, here in the front.
Is it transferable to other animals?
So the only other animal that we would be concerned about would be other equines, so donkeys, mules, zebras, and then our camelids are susceptible to herpes virus as well, so alpacas and llamas.
So
yes?
Does one presume that the horse has a snotty nose and it's got rhino? Or is there other things that could be doing?
Yes, there's a whole bunch of other diseases that can cause the respiratory disease, that can cause abortion, and that can cause neurologic disease, right? So we don't jump to this disease immediately. We want to see, okay, what is the age of the horse? What happened just prior to the horse? Did it travel? Was it exposed to another horse with a snotty nose? Could it potentially be strangles? You know, any other infectious diseases. So there's a whole bunch of things that we have to think about. And I would say most commonly if the horse, you know, has a little bit of a snotty nose, otherwise bright, happy eating, okay, we're not gonna, again, pull out all the stops and put on our Tyvek suits. But if we start to see more, or potentially it's spreading because other horses are getting sick, then we might want to say, hey, veterinarian, please come to my barn, I want to check things out. And then based on that discussion, you can then say, well, I'm just going to do biosecurity, or I'm going to potentially do some testing.
When is the best time of the year to vaccinate for the rhino?
So because our season is kind of winter, spring, again, depending on how many times per year you vaccinate, you want to vaccinate before that time, right? So that immunity is the best. So I would say basically, you know, coming in the fall is a good one because we're going into the winter time. And if you're FAI, you do it twice a year, and it's typically spring and then fall as far as vaccinating twice a year. Oh, there, I can't see you there, yeah.
Is a simple spray of Herpes effective at all against the virus? So you're going out to a show, you think, you know what, I'll just spray it down. Is it actually effective, or are you wasting your time?
So the question is, can we just spray some Vercol on some areas and then call it good? That really depends on how clean that area is. If there is biomaterial on there, so dust, manure, urine, straw, that is all biomaterial. So bleach and Vercol get inactivated if they touch that biomaterial. So anytime that we want to disinfect anything, we want to clean it with just a regular water and soap. obviously get all that biomaterial away as best we can. Then we want to use our disinfectant, like Virkon or the dilute bleach. We leave that on for about 10-15 minutes. And then we want to rinse well, because we also don't want the horse to be exposed to any of those disinfectants if they dry up on there. And then you would say, I have a good disinfection protocol. If I have a wall that is totally dirty with manure and I spray some Virkon on there, you're wasting your time. You might as well not do it then. Any other questions? Did I fulfill my role as far as not being in the planning role, being in the non-planning role?
Great, thank you, Jillian. That's kind of it for today.